So this training is going to cover the supervisor portion for reasonable suspicion as required by FDOT. So we'll get started on slide 2 here. So an employer must provide employees who perform DOT safety-sensitive function material that explains the DOT requirements. So basically, employers need to give their employees who are doing these anything reasonable suspicion for drugs and or alcohol, the material and what it entails for them. It also has to be documented and kept in a record-keeping process that the supervisors have received the material. Things in this should include the names and contract of the persons that are trained, the duties of the employee who are subject to the program, the employee contact, that is the requirement that employees must be tested for drugs and alcohol, when and under what circumstances employees must be tested, whether it's some sort of reasonable suspicion, whatever falls under that category, a vehicle accident, an injury at work, performance-based circumstances. It also needs to include the testing procedure that's going to be used for the employee and a explanation of what a refusal for a test is. So pretty much if you have an employee that falls under one of these categories and they refuse a test from the supervisor, usually that ends up is counted as an automatic fail for their drug examination. Some more stuff continuing the employee and supervisor education and things that follow along with that. Also, along with refusing a drug test, the employee needs to know an explanation of the consequences for refusing that drug test if they are pulled for one. They also need to know the consequences for violating a DOT rule, such as a CDL driver, if they fail a drug exam or refuse to take it. Things like they'll lose their license, or how long they'll lose their license, or they'll have their license suspended, things like that. They also need to include information on the effects of drug and alcohol on the employee's health and the work and their personal life. That goes without saying. The signs and symptoms of drug and alcohol misuse, and that's what we're going to cover today for supervisors, what to look for in the workplace. And that pretty much sums up everything there. Now we will move on to the 5 types of drugs that are tested under DOT, and this includes alcohol. So we have 5 types of drugs that are tested, also alcohol. And to be able to use reasonable suspicion as a supervisor, an employee must provide training to all persons who supervise drivers. They're also subject to this regulation. The purpose of this training is to enable supervisors to determine whether reasonable suspicion exists to require a driver to undergo testing. And this goes for all DOT employees. It doesn't necessarily have to be a driver. Anyone that falls under DOT drug and alcohol testing rules. It must include at least 60 minutes of training on alcohol misuse and 60 minutes of training on controlled substance abuse. So we'll have a total of a minute and 120 minutes of training for reasonable suspicion reasons. So, of course, first one, alcohol. The few physical symptoms we have listed here for alcohol abuse in the workplace is going to be bloodshot eyes, constricted pupils, odors, probably going to be the biggest one. You're going to be able to smell the alcohol on the breath and sweat, things like that. Anybody that's been around someone that hasn't been drinking, or that has been drinking and you haven't, you pretty much tell right away. So behavior is another big one. Memory impairment, sleepy at work, drinking all night, or drinking on the job. Aggressive behavior is also a sign of alcohol abuse in the workplace and outside of the workplace, but it's taking a lagging effect over into their job. Another big one, usually a pretty good giveaway, is slurred speech or double speaking. People repeat themselves a lot. That's going to be one that's probably more drinking on the job, like drinking at lunch or sneaking a drink, going to their truck or whatever it is. And of course, poor performance is going to fall into that. If you're drinking on the job or drinking at home too much at night, your work life's going to suffer as well. So that covers alcohol. So now we'll move on to the 5 types of controlled substances that are tested under the DOT drug policy. First one we have here is marijuana. Odor, dry mouth, drinking a lot of water, which, that's really not that big a deal, or not really going to be noticeable, especially when it's hot. Summertime, people are drinking water. Odor is going to be a big one. Clothes stinking, taking long breaks to their car. Bloodshot eyes are going to be another noticeable one. Dilated pupils. The behavior side of this is going to could be pretty bad anxiety, be paranoid. We're not really going to probably see many speech impairments with marijuana use. It's mainly going to be these physical, behavioral, and performance. So performance-wise, lack of motivation. They're going to be lazy. Slow reaction time to other things, which might not be too noticeable in the workplace, but it could be. The main thing you're going to be looking for is odor and anxiety and the lack of motivation. And moving on here, we have cocaine. So this is probably going to be a kind of a tougher one to determine, which, we're just looking at indicators that they're using drugs, not the specific drug that they're using. The drug test will determine that, but we're going to see a lot of sweating. Since cocaine is a stimulant and it, gets your heart rate moving, people are probably going to be sweating a lot more, doing a lot more. As far as behavioral, they're going to be really alert and really not necessarily on edge, but, they're ready to go. Could be anxiety as well. Speech, they're probably going to be talking a lot, maybe more than normal. Or if, this person has just started using a specific drug or whatever, they might be, talking a lot more than normal or rambling on. Performance, this could be a really dangerous one. So overconfidence. So you might notice taking unnecessary risks or things of that nature. Moving on, we have amphetamines here. So this is going to be a laundry list of drugs that kind of fall under this category, but they all pretty much have the same indicators that we're going to be looking for. So as far as physical goes, this bulletin we have here for weight loss, this is going to be over a long period of time that you would see this, and it's not necessarily one you're going to point out, on the job. So that's not really a good one, but it is one that's listed. So irregular heartbeat, again, not one you're going to notice on the job really, because you're not walking around with stethoscope listening to people's heartbeat, and we're not doctors. So tremors, so seizure-like behavior, not necessarily a seizure, but could be having the shakes. Behavioral side of things is probably going to be the most noticeable. Paranormal alertness, anxiety, people that don't normally, show these kind of symptoms, might be showing these a little more, especially if they just started using these drugs. Speech, confusion, I'll look out for that. And then, a lot of these could be, we can mistake a lot of these maybe for some kind of heat illness as well. So there are a lot of these indicators of these controlled substances have the same effects on a person as a heat injury or heat illness would. So it got to be, look to kind of differentiate these. And we have, moving on here, we have opioids, which, there's several. A lot of these are going to be over-the-counter drugs, obviously, but so we could have blurry vision, which is something you're probably not going to notice unless the employee just tells you. Excuse me. Dry mouth, itchy skin, itching under the nose, usually around the face. That's usually a pretty big one of opioids. Behavior, obviously sleepiness, because these are, a downer, a depressant. So sleepiness is going to be one. Speech, we have confusion, slurred speech. Again, it's kind of shutting off our brain function a little bit. So those are a couple other indicators. And performance, insomnia, people doing these drugs, staying up all night, and a depressive state. So, of course, when you're checking everybody or talking to them, if they're depressed or seem like they're depressed, you need to talk to them. Make sure there's not other things going on. And, of course, we want to kind of check them over to see if they could be using a controlled substance. And moving on to PCP here. So this is a pretty dangerous one. So physical, increased heart rate, increased blood pressure, rapid breathing. All these could be signs of a heat illness as well. So we got to try to differentiate between the two. Behavior, delusions, distress, hallucinations, and these are some things that you will notice on the job. And, those are some good things to look for. Speech, confusion, also could be related to some sort of heat injury or heat illness as well. And performance, muscle cramps, loss of coordination, all those are good also to look at, especially looking back at alcohol use as well. And that is going to cover most of what we needed to cover for the 5 types of drugs and alcohol that are going to be looked at from a DOT standpoint for reasonable suspicion for supervisors. Again, this training there's an hour required for drugs and an hour required for alcohol per DOT.